Hi, I'm Dr. Matson. Today we're covering Chapter 3 in the Public Health Community and Practice chapter, and this is in the Open Stax Population for Health for Nurses textbook. So basically, what we're going to cover today, we're going to be looking at public health nursing, think about the scopes, but really ultimately we're talking about professional practice. So when we're defining public health nursing, right, we're looking at that assessment, which you guys covered in detail in the beginning, assurance, and policy development. So by the end of this, you guys will be defining it. We're also going to be looking at major historical events that shaped it and really show our identity in public health and think about these nurse leaders who really have influenced public health practice, and then we're going to be thinking about professionalism. So in 1949, the National Organization of Public Health Nurses distinguished community health nursing from public health nursing. So when we think about community health nursing, this is caring for individuals and families with the latest practices, while public health is really looking at population-based strategy. So in World War II, after community health nurses contributed to the war, President Truman declared them as one of the most important groups of healthcare workers. When the Legionnaires' disease in 1976, which was a new form of pneumonia that emerged, happened, there was a conference from the American Legion members. So the CDC studied it, monitored the outbreak, and this really began to show these epidemiological principles that now inform how we practice in this public health space. When HIV and AIDS emerged in the 1980s, really there wasn't a lot known about it, and then public health nurses really had a larger role in preventing its spread and managing the condition. And then in a very real way, we see how nurses had a very big influence in the COVID-19 pandemic and beyond. And this public community health nursing really shows this pivotal role in the United States with this response, adaptation, and flexibility in facing the pandemic. We also see the passage of ACA, which is aimed to increase care and accessibility for all. And really we see nurses help the public adapt in this way. Here we see three nurses who were very influential in how nursing was practiced during their time. We have Florence Nightingale, who was a figure in shaping modern nursing, especially with epidemiology, but she perpetuated prejudice, colonial, and classic ideas. We see Harriet Tubman, who was enslaved and was a nurse and made great contributions to nursing and public health during the Civil War. And we see Sojourner Truth, who was freed following the New York's Emancipation Act in 1827, and then spent the rest of her life advocating for abolishing slavery, women's rights, and humanitarian causes, and funds for nursing training. We also see Lillian Ward, and some consider her really the founder of modern public health. 1893, she founded the Henry Street Settlement in New York City, and this was helping people who were sick obtain resources like care in their homes, transportation, medicine, food, loans, childcare, job training. We also see Cori Bush, which is a member of the United States House of Representatives and a nurse. And then we see Bonnie Castillo, who is a registered nurse and executive director in the largest nursing union and professional association in the United States. So now we're going to talk about the scopes and practice of public health nursing. Think about kind of the community and public health nursing core competencies, the attitudes, and then we'll talk about this Quad Council coalition. So public health, community health nursing is a specialty, and as we have seen throughout this semester, it's really looking at improving health in communities and populations. So nurses work in this interprofessional team. This can be clinicians, community members, community partners, and policymakers to really support righting the health disparities and injustices to ensure equitable access to a healthy life. So when we think of the scopes of practice, so the scope of practice refers to professional activities involved in a particular role. And then we have the standards of practice, so principles and guidelines to which a professional must adhere. And there are really 9 core concepts of practice identified by the ANA. The first is social determinants of health, then community collaboration, population health, the ecological model of health, so from micro to macro levels, and then culturally congruent practice, so we're thinking respectful, equitable, and inclusionary, the levels of prevention, ethics, social justice, and health equity. For the scopes and standards of practice, so the ANA has developed 18 standards of practice and professional performance for public health nursing. So these standards for practice for nurses are in any discipline or specialty, and these define the who, what, where, and why, and how of the specialty. We think public health, community health nurses really need this strong knowledge of epidemiology, environmental health, social determinants of health, statistics, evidence-based practice, health promotion, and factors that impact health. And this means that they're strong in these skills of communication and relationship building. In terms of core competencies, these refer to foundational skills and attitudes that nurses need. So we think about the technical skills, and we can see this if they're working in the county and they're going out to homes and doing assessments, injections, and then personal qualities, being able to communicate with people, relate to them, and the professional behaviors. So 4 nursing organizations formed the Quad Council in 1988 and worked together to develop community public health nursing competencies. So here we're going to talk about how this public health system interfaces with nursing care, and then think about this role, especially in terms of professional practice. So the role and significance of community health, public health nurses, we're thinking about health promotion and education. So we see this education in individuals, families, and communities, and this can really range health topics. So preventative measures, wellness. We also see this something called social prescribing, which involves referrals to community resources other than those that are traditionally considered. So for example, we think about financial planning, walking groups, and then community assessment. So this really assesses communities or groups to determine what is the health problem, the health risk, and the needs for teaching and intervention. So you can look it up in San Diego. These are done by different hospitals. So Kaiser has one as a community assessment that really summarizes this. And then health advocacy. So this advocates for services and programming that the community needs. So when we think about disease and disaster response, we spent a little time on this already, and we saw how public health nurses really think about preventing the spread of disease, and this could be by administering immunization. So some people were writing about Hep A, right? And then screening for infections and communicable diseases. So we saw that within COVID-19, and then providing education on infection control and really educating community members on disease mitigation and self-assessment. In terms of disasters, we see public health nurses really looking at establishing response plans and really coordinating and mobilizing resources. So for example, in the fires or floods, and then ensuring resources are really there to help people stay safe and healthy and have these resources available during a crisis. So public health, these are really, when we think of foundations in nursing practice, so nurses set goals related to each essential service and core function. So this would be implementing interventions, leading aspects of care and community health that really meets the needs of the broader population and provides direct care, education, and assessment. When we think about this care in the public health, community health nurses, it's really guiding their practice with these core functions of a public health nurse. And we see these in this essential public health services. So really what we did was we talked about public health nursing. We looked at different leaders and then thought about really scope and function.